Now let's get to our big story, and it starts with some excited passengers on a Delta flight.
That the Transportation Security Administration will no longer enforce the federal mandate requiring masks in all U.S. airports and onboard aircraft.
Lots of people taking their masks off there. It's the end of the mask mandate, at least for now, on public transportation. This does not mean it's the end of the pandemic. We'll get to that in a moment. But as of right now, if you don't want to, you don't have to wear your mask on a plane, a train, an automobile. It's because a federal judge in Florida struck down the mask mandate. Not the CDC, not a doctor, a 35-year-old judge appointed by the Trump administration and confirmed even though she was deemed not qualified by the American Bar Association. The group found that she had about 5 years experience practicing law when they say 12 is the minimum that they recommend. They did note she has a keen intellect, though. Here's what happened. First, the CDC announced that it was going to extend the mandate for public transportation until May 3rd. Then the judge, Catherine Kimball Mizell, said the CDC was relying on a law from 1944 called the Public Health Service Act, and that the government claimed masks are in place for sanitation. But Judge Kimball Mizell said the masks don't sanitize and that the CDC exceeded its legal authority. That was in response to a lawsuit brought by a conservative legal group called the Health Freedom Defense Fund. The Biden administration said the Justice Department will appeal the ruling depending on what the CDC recommends, so things could still change. But for now, the mask mandate will not be in effect. You can take your mask off now at the airport, including PDX, and on all major airlines. Also, TriMet, C-Tran, and the Portland streetcar, and Amtrak train and Greyhound buses, and Uber and Lyfts. Of course, you can choose to keep wearing your mask in those places too if you want to, if you feel better doing so, and all the agencies we talked with are actually encouraging passengers to be understanding towards people who do want to continue to wear a mask. One place you'll still need to wear a mask is your doctor's office or the hospital. The mask mandate for healthcare settings has not been lifted. The Multnomah County health officials are also encouraging people to continue to wear a mask despite the judge's ruling. Multnomah County Public Health Director Jessica Guernsey sent out a statement saying that she encourages everyone to continue wearing high-quality masks on public transportation to protect themselves and people who are unvaccinated or those who spend time with people who are unvaccinated, including children. She went on to say masking on public transit is a small effort with potentially large yield in protecting our community. And let's take a look at where we stand with the pandemic. It wasn't too long ago that mask mandates were lifted in Oregon and Washington, and cases kind of started to creep up again. I talked today with Peter Graven from OHSU. He's the one who's done the COVID case forecast for Oregon throughout the pandemic. He's trying to predict how high cases will get.
The data is showing some increases in cases. That's across the state, with probably a little bit more increase going on in the Portland metro area. That was largely expected. So we were seeing cases and hospitalizations go up a little bit in Europe. Actually, the case counts got pretty high in Europe. Then we started seeing in the northeast of the U.S., the states there, New York, Vermont, all through the northeast, started seeing increases, and now we're seeing that here. We do think that has been largely due to the BA2 variant of Omicron, as well as the slightly faster growth in some of our areas in the city where they had previously higher masking rates. And so we know so it is potentially the case that as masking mandates went away, that there was some increase in infection that happened from that. However, it's been largely manageable in the terms of the number of people hospitalized. So even though cases have gone up in some of these places, that we aren't seeing the hospitalizations that come with.
Graven says we have a lot of immunity built up in the population right now between vaccines and boosters and previous infections. There just aren't that many people left who haven't had some kind of exposure to COVID. So even though it's still out there and it's still highly transmissible, hospitals are just not seeing the same severity that we had last summer during the Delta wave. But he cautions COVID is not yet done with us, and masks were helping to slow it down.
The data is showing some increases in cases. That's across the state, with probably a little bit more increase going on in the Portland metro area. And that was largely expected. So we were seeing cases and hospitalizations go up a little bit in Europe. Actually, the case counts got pretty high in Europe. Then we started seeing in the northeast of the U.S., the states there, New York, Vermont, all through the northeast, started seeing increases, and now we're seeing that here. We do think that has been largely due to the BA.2 variant of Omicron, as well as the slightly faster growth in some of our areas in the city where they had previously higher masking rates, and so we know as the so it is.
It's not your memory. That was accidentally the same comment again. So you got it twice. One thing to note before we finish up, if you were banned from an airline for being unruly over the mask mandates, things have not changed for you. If you started fights with flight attendants or other passengers, most airlines say you are still banned.